Welcome back. This October, in honor of Cancer Awareness Month, also widely recognized as Pink Month, we're joined by Dr. Cornelia Ndifon from Stirling Medical Centre. She's here to discuss the importance of cancer awareness, the most common cancers affecting men, women, as well as children, and the ways individuals and families can take proactive steps towards prevention and early detection. Dr. Ndifon will also share how Stirling Medical Centre and herself are participating in this vital awareness campaign. Doctor, good evening and welcome.
Good evening, Nina.
Thank you so much for being here.
Good evening, Namibia.
Well, Doctor, explain to us in your own words what Cancer Awareness Month, stands for, why it's important to engage with the public around this.
Yeah, that's a very good opening. So cancer awareness is all about keeping the momentum going on topical public health issues. And of course, we know about TB month, we know about all those. So for October, it is about cancer. And it is a time to use to educate the public, give them information about symptoms of cancer, risk factors, prevention modalities, and treatment. But because we want to give that awareness and encourage people to go and screen early, so we talk about early warning signs and talk about, early stages of cancer when it is best picked for prevention. Yeah. Because to be honest with you, full-blown cancer is not the best for anybody. Yeah. And you know that we say prevention is always better than cure. So during the awareness month, we just keep, like I said, that momentum on that topical public health issue, that you want to fix, you want to address. Yeah. Because if you don't set a particular month where you intensify activities, then people will just let it go by. And we as human beings, once the real disease comes, that's when everybody is crying, everybody is blaming somebody. Why are we not doing anything? So that awareness month, it helps us to talk more, to draw our attention, to do something, and actually gives us an opportunity. Maybe there are new developments in the horizon. Right. Yes, we use that time, to kind of update on what is going on around a particular topic, but for October is cancer.
Doctor, what's the most popular cancer amongst women? At some point it was breast cancer. Is that still the case?
Yes, it's still like that. And I will try to, globally actually, breast cancer is #1, but therefore in Namibia it is also the same case, followed by cervical cancer. Yeah. Yes, and a third cancer is called Kaposi sarcoma. Yeah.
And what is the third cancer in layman's term?
Yeah, it's just cancer of blood vessels and limbs, but it is also mostly common with HIV-positive people. And if you know the history of Namibia and HIV, then you can understand why it is a third.
Right. Yeah. And when it comes to men and children, what are the most common cancers there?
Okay, for men, it is prostate cancer. Okay, and then this same Kaposi sarcoma comes in. Okay. Then you now talk about what they call non-Hodgkin's lymphoma, and that is actually referring to cancer of white blood cells, just to make it simple.
Yeah, yeah. And within children?
And then in children, I will call 4 cancers. I'm not able to say which one is #1. Right. But you have leukemia, which is generally cancer of the blood. Yeah. Then you have lymphoma. Now it's like a subset of the blood because we talk about red blood cells and white blood cells. Right. Then you have nephroblastoma, that is cancer of the kidney. And the 4th is a neuroblastoma, brain. Yeah. But like I said, I'm not a specialist, I'm neither a pediatrician, but generally the top 4 in children.
Yeah, yeah. Doctor, how's Stirling Medical Centre contributing to Cancer Awareness Month?
Yes, so at Stirling Medical Centre, what we do is that we give education on an individual basis. A private practice, people don't come as a crowd. And sometimes it's very difficult to organize something that you say group counseling. But on one-on-one basis, I'm literally talking about cervical cancer every day. Wow. So apart from that counseling, then we actually provide the pap smear and HPV DNA testing. Okay, then we also talk about HPV vaccination. At least we give that information because, some parents are not interested, or those who are interested, we give them that information. They go get the vaccine, which we administer. Okay, and then when we get the results for the pap smears, for example, whatever is there, we call the patient and give them feedback. If there are abnormalities, then we go the next step, because the whole essence of doing screening and pap smear is to look for these abnormalities. They are not cancers at all. We call them pre-cancer.
Right.
So when we see them, then we remove them. We can remove them by a process called biopsy, where we now go to really look into the molecular level, you know, and say, is this stage 1 pre-cancer, then phase 2 or phase 3? And because the higher the number, the closer we are getting to cancer.
Of course, of course.
Are you getting me? And then if there's nothing, we inform the woman. Now, when it comes to how we manage pap smear results, if a woman is HIV positive and the pap smear is negative, we repeat every year. But once there's a problem now, then we manage it.
Yes.
Okay.
Yes.
If a woman is HIV negative, the pap smear is negative and HPV DNA is negative, then we screen every 3 to 5 years. But once there is abnormality, the management changes. Because I can say, okay, this week you came, madam, your result is like this. It's normal. Then I do those things. It's abnormal. You need to come so that we either burn those abnormal changes or we remove them.
Right.
Yes.
In your personal capacity, how are you participating? I see that you're going to be doing some radio conversations as well with Dr. Kagiso Molloy, who's a favorite here at NBC. Talk to us about that.
Yeah, you know, I'm laughing because it is really personal, you know, not because I have cancer or ever had cancer, but I've had a sibling die from cancer. I have an aunt who died from cancer, and that was way back when I was in medical school. Then the mere fact that I am a medical doctor and I had worked in obstetrics and gynae dealing with women's health, I have seen firsthand late-stage cancer. And sometimes in people below the age of 30. It is terrible. It's devastating, it's shocking, you know. And so all those things motivate me. But to crown it all up, I hold a master's degree in public health. And I did, one of the modules I did was health promotion. So this kind of gave me the tools, you know, grounded me in saying that, no, I don't want to be a doctor that is just waiting for late-stage cancer that we can't really do much about, but to start talking to our people. Yeah, even before people become patients, you know, people will say client and patient. But we are just asking people that, look, when you feel well, that is when to go for screening. You cannot do pap smear when cancer is obvious. We say naked eye. And I saw a case last week, Thursday, that really broke my heart. And this patient just said that she's never done pap smear. And what I saw there was just like what we call stage 3 cancer. Maybe we will get feedback later, but it was just, I was just sad. Because she told me that she hadn't done pap smear and she was 52.
And never done a pap smear before?
Never done a pap smear. Wow. And then you find those who say, oh, doctor, they say that it's painful. I'm like, it is not. It's not painful. And I'm not trying to make you feel okay. It is true that pap smear is not painful. So that's, of course, part of the awareness that needs to be created also during campaigns like this about the procedures and how they're not so invasive and not as painful as people make it seem. Yes, it's not at all. I've told, when I was on radio with, was it, I think I came here on Tuesday. I was saying that I was on Good Morning Namibia, that pap smear is something you can leave office at lunchtime, and come and do the pap smear and go back. And pap smear, it has steps. Like I said, we are taking the sample, then we send it to the lab, where they do the smear and the staining and analysis and give us result. And then when you get the result, we can say pap smear is complete. You don't go to any facility or clinic or my practice and we do pap smear now and give you result now.
Well, Dr. Ndifon, we appreciate your time. Thank you so much for joining us this evening.
Thank you. It's always a pleasure.
That was Dr. Cornelia Ndifon speaking to us there about Cancer Awareness Month and, of course, how her practice will be engaging and bringing awareness to the general public on this matter. We're going to be back